Hello, everyone. This is Dr. Jan from Loma Linda University. I'm here to talk about the coronavirus vaccines with you all. So, here's a little bit of what we'll talk about in regards to the vaccines. So we'll talk about different types of vaccines. We'll talk about the coronavirus spike protein mutations. We'll talk a bit about the COVID-19 clinical studies. And then we'll round it out talking about COVID-19 in pregnancy. And then finally, we'll talk a bit about recommendations in regard to the vaccines. So with the vaccines, we can have different types of vaccines, one of which being live and then the other being inactivated or killed, the ones that we're talking about right now. So a live vaccine is a weakened part of a vaccine. So that means that it's a small part of a vaccine that's where a virus that's injected into you and then your body mounts a response or develops protection against this particular virus. Inactivated vaccines are exactly the way that they sound. They are dead or they are killed viruses, meaning that they've gone through chemicals, they've gone through fire, they've been degraded. However, they still maintain a little bit of their integrity, so you're still able to mount a response or protection against this. So, an example of this would be the Tdap vaccine. So, with the Tdap vaccine, we know that you have to get a booster about every few years or so, every 10. So, why do we have to get this? We get this because these are inactivated or killed vaccines, meaning that although your body mounts a response, because you're not seeing these viruses live or you're not seeing a weakened part of a live virus, then your body isn't able to mount its maximal amount of protection. So you have to get what's called a booster so that your body remembers that it's seen this virus before, that it's made protection against it, and that it's able to continue to protect you should you ever see these viruses or these bacteria in real life. And in regard to the coronavirus, we have two particular vaccines that are being studied and that are going to be amongst us currently. So we have the mRNA vaccines and then we have the adenovirus-vector vaccines. So with the mRNA vaccines, um, mRNA is readily occurring in our bodies. We normally have a messenger RNA. It's very short lasting. It's in no way turned into DNA. So what it does is it sends messages to our bodies to make particular proteins for our survival. But in this case, that mRNA sends a message to our bodies to make the spike protein. That spike protein is significant to the coronavirus. So it's what makes the coronavirus that we currently know, COVID-19. So the messenger RNA is injected into you. It sends a message to your cells and it says, hey, you need to make this specific spike protein. Once your cells make this spike protein, your body then sees it and then it's able to make protection against this spike protein. So, should you ever see the coronavirus in real life, your body knows that it has antibodies or it has protection against it, against that particular coronavirus that you do see, so that you are not, so that hopefully you are not as affected as you would be should you not get vaccinated. So, as I said, this mRNA is in no way integrated into our DNAs. mRNA is very short lasting. So, once that message is received by our cells to make that spike protein, that mRNA is then degraded, never to be seen again. So, that's how our mRNA vaccines work. Currently, we have the Pfizer and Moderna COVID-19 vaccines that are mRNA vaccines. We also have adenovirus-vectored vaccines. So these kind of mimic the mRNA vaccines a little bit in what it is that they deliver to our cells. So adenoviruses they aren't able to mount a true infection in humans, meaning they aren't able to cause true infections. They're kind of similar to like a mild cold in human beings. So with that being said, when these adenovirus vector vaccines are injected into you, your body thinks that it's actually seeing an actual virus. But remember what I said, it's not able to cause true infection in humans. So what it's actually seeing is specific material or specific information to make that spike protein, kind of similar to the mRNA vaccines. So once our bodies essentially see that information for that spike protein, our body makes that spike protein. It is able to then forge protection against this spike protein. So, should we ever see that spike protein from the coronavirus in real life, you'll be protected because you would have seen it through this vaccine. So, examples of this would be the Johnson and Johnson and then the AstraZeneca vaccines. So often I've gotten questions about these vaccines as if these vaccines are able to have mutations, why should I be protected? Why should I go ahead and get that vaccine if there's just going to be mutation and the vaccine won't work anymore? So let's talk a little bit about these spike proteins and the protection that you develop against these spike proteins, and why it's important that even though there are mutations, that we continue to get vaccinated. So I think this picture does a really good job. So this is an example of the spike protein that I talked about briefly that is very signature to coronavirus. So here we see this spike protein. And then we see this protection that we make against the spike protein. So we see this, it says T cells, and then we see this antibodies. So these are the different type of protection that we make against this particular spike protein. T cells are the first step of protection that our body makes against that spike protein. So you get that first injection of the coronavirus vaccine. The minute that your body makes that spike protein, it immediately releases T cells. And it's like, oh no, this is something that's not supposed to be here. We have to have these cells go and protect us against this invader. So then it unleashes the T cells. So then after some time, we develop what's called antibodies. And that's our second tier of protection, because it's important that we're protected from this coronavirus. So we have two different branches of protection. So then we have these antibodies that come out to help those T cells to continue to protect us. So we see we have this spike protein, and we see these protectors bind or attach to different areas of that spike protein. So we see we have a blue antibody, we have a yellow antibody, we have a purple one, we have a green one, we have a pink one. We have these different T cells. We see the spike protein, and in different areas of this spike protein, we see these protectors bind to different areas here. So let's move to this side of the picture. In this side of the picture, we can see that this one particular antibody doesn't work anymore. And this is because of what we call a mutation, meaning that while our bodies are smart, viruses are smart as well. So they know when we're able to protect ourselves. So then they change themselves a little bit to kind of deflect or kind of make our protection not work as well as it did prior. So we see that this one particular antibody is no longer working, and that's because of the mutation or because of the change. However, we still see that these different antibodies are able to bind to these different areas of the spike protein. So what does this all mean? This means that despite the mutations or despite the fact that one antibody or two antibodies may not work, we still have other ones that'll still be able to protect us as against that spike protein. So that means that it's still important to get vaccinated, because although we may not have all of the antibodies that or all of the protection that we previously had, we'll still have some and we'll still be in better shape than if we were not to get vaccinated at all. So here's a bit of information about the clinical studies. I think it's important that we're able to see, where do they get all of these numbers from? Let's make a little bit of sense about that. So in total, there were about 40,000 participants, which honestly are the most amount of participants that we've had in a lot of clinical studies. So it was a lot of people that participated to see if this vaccine really worked well. So the studies that were conducted are called randomized controlled trials. And what that means is that there were a random amount of people that received the vaccine, and there were a random amount of people that did not receive the vaccine. And it's about an equal number of people in each group. But they do this to make sure that one, the vaccine works better than if you were to receive nothing. And two, they want to make sure that it's fair and that they can see the maximum benefit in a fair number of people. So I also think that it's important that we really see who are these people that were represented, and we know from the news, and we know from all the reports that we see that Black people have been largely affected. We know that Latino people have been largely affected. We know Native Americans have been, and we know that those individuals that are greater than or equal to 55, I don't like to call them older, I like to call them seasoned. We know that they've been greatly affected, right? We know that they have died in large numbers. So we want to make sure that these people were adequately represented in these studies. So there were about 34 to 3,400, a bit over that in this study, meaning that there were 1,700 people that received that vaccine, and there were 1,700 people that did not receive the vaccine. There were about 28% that were Hispanic. About 0.5% of the study included individuals that were Native American, and about 42.2%, so a little less than half, that were greater than or equal to 55 years old. So I know that 9.3% for blacks looks small, but I think it's important that we recognize that black people make up only 12.5% of the United States population. The same for Latinos, Hispanics, they make up about 28 to 29% of the United States population. Native Americans make up about 1.6%. So while these numbers seem small, they're actually quite representative of what these different racial groups make up in the entire United States population. So now we want to know, what are the number of COVID-19 cases? What did they see? So after the first dose, there were not 39 cases of COVID-19 in the group that received the vaccine, and then 82 in the group that did not receive the vaccine. So what is that? What do we know from that? What does that mean? So that means that, of course, less individuals receive COVID-19, have developed COVID-19, have they been vaccinated? So we see some type of efficacy there. We see some type of success there, but not as much as we would have hoped to see. We want to see a little bit better. So then we move into after that second dose. How many did they see there? Because that's important. These studies were designed to see, after receiving two doses, how protected would people be against COVID-19? So after receiving that second dose, we saw 95% efficacy. What does that mean? That means that 8 people in the group that received the COVID-19 vaccine developed COVID-19, and 162 in the group that did not receive the vaccine developed COVID-19. So that means that there were more cases, or more people developed COVID-19 in that group that did not receive the vaccine. So that shows us how important that vaccine is. And that means that we have about 95% efficacy. So that's where we get that number from, that we hear in the news, we hear in the media. So what we really want to know is, what are the numbers of severe COVID-19 cases? Because we know that while we see some good success, there were still people that developed COVID-19. So that means that even though you get vaccinated, you can still develop COVID-19. But we know that it's severe COVID-19 that we should be worried about, right? Because when you get severe COVID-19, that's what puts you in the hospital. That's what makes it really bad. So there were 10 cases total in this study of severe COVID-19. However, there was only one case in that group that got vaccinated. So that's important to know. So there were 9 cases of severe COVID-19 in that group, in the group that did not receive the vaccine, but there was only one in the vaccination group. So that shows us the importance of getting vaccinated and protecting us against getting severe COVID-19 and keeping us off that ventilator. So of course, building immunity doesn't come without its collateral effects. So the way that our body protects us is at higher temperatures. So that means that when you get vaccinated, because your body is developing protection, it's releasing those T cells that we talked about, and those antibodies, those different levels of protection. It has to do that at a higher temperature. So you may get a low grade fever. You may feel a little pain at that injection site where you got injected at, and that's because you're getting vaccinated. You may get a bit of a headache. You may feel a little sluggish, a little tired. And that's because when you get a fever, you feel a little bit crappy. So that's normal for that to happen. But it's important to know that you can take a bit of Tylenol, and make sure that you talk to your healthcare provider, of course, your primary care provider, or your pharmacist, and you ask them if it's okay for you, given different medications that you may take, to take Tylenol. But you take a bit of Tylenol, and then you should be just fine. I myself received the Pfizer vaccine. After the first dose, I was pretty much okay. I did have a bit of arm pain, but it was manageable. After the second dose, I did feel a little bit sluggish, and it was likely due to me having a lower grade fever. And this excited me because it let me know that my immune system was working. It let me know that my body was making protection for me against COVID-19. And I took a little bit of Tylenol, and I was just fine afterwards. It only lasted about 24 hours. And then we have the Moderna vaccine, which is an mRNA vaccine, just like the Pfizer study, like we talked about. And there were about almost the same number of participants as the Pfizer study, a little bit less, so a little over 30,000 in this study. Once again, equally split between the group that did receive the vaccine and then the group that did not receive the vaccine. There was about the same number of Black individuals, Latino individuals, Native American individuals, and those that were greater than or equal to 65. And why is that? Why is it that we worry about these groups? Because these are the groups that are most affected by COVID-19 for what we see in the numbers as far as the ones that end up dying from the virus. So we want to know, do these vaccines work in these groups? And we want to make sure that the representation or the number of people we see in these groups in the studies are representative to what we represent in the United States. We want to know that. We want to make sure that we look the same as those individuals that were included in the studies. So, in regard to the number of COVID 19 cases after that first dose, there were 9 in that group that received the vaccine, and then 67 in that group that did not receive the vaccine after the first dose. But I do want to make sure that I talk about just looking at these numbers of after the first dose, those that become infected versus those that do not. And I think that because these studies were not designed to look after that first dose, we can't really trust that those numbers were taken that those numbers were taken when they should have been, that those numbers are completely accurate, that those that the tests were taken exactly when they should have been. And that's just because that's not exactly what these studies were made to look at. They were made to look at the second dose because we know that we have to receive 2 doses of these mRNA vaccines to have adequate protection against the virus. So let's focus on the second dose. So after the second dose, in that group that received the vaccine, 11 individuals developed COVID-19 versus 185 individuals after that second dose. So what does that mean? About 94.1% efficacy. So it was 94.1% effective, meaning there were less individuals that received the vaccine that developed COVID-19 versus those that did not receive the vaccine. Amazing. So, number of severe COVID 19 cases, there were 30 cases of severe COVID 19 total, meaning 30 people developed severe COVID 19. And we know that even though we get this vaccine, you can clearly still develop the virus afterwards. But we want to make sure that if we were to develop this virus, that it wouldn't be severe COVID 19 because we know severe COVID 19 is what leads to death, what leads to us being on ventilators. That's what we're really worried about. So there were 30 cases total in the study, but none of them occurred in those individuals that received the vaccine. So receiving that Moderna vaccine equal to no people having severe COVID-19, which is important. That's what we want to focus on. Once again, like I talked about previously, developing that immunity doesn't come without its collateral effects. So that means that you can have a low grade fever, and that's because our body protects us at higher temperatures. When you have that low grade fever, then of course it makes you feel a little bad and you can have a headache. You might feel a little tired and you might have a little pain at that injection site. So I think it's important we just put all of this into perspective. I know I use a lot of numbers. So we see the COVID 19 cases, right? We see that, and then we see just an increase in cases in that placebo group. So in that group that did not receive the vaccine. But look at that group that received the vaccine, almost zero, right? So we see a lot of cases here, and we see not very many here. So that's how important it is for us to go ahead and get that COVID-19 vaccine. That's the difference between not getting vaccinated and getting vaccinated. So just the COVID-19 vaccine and pregnancy. So in the Moderna study, there were about 13 participants that were pregnant, and these participants didn't know that they were pregnant before they participated in the study. So 6 of those individuals received the vaccine, and then 7 of those did not. As I told you guys, these studies are they try to split them equally in the amount of participants. So that means that some people receive the vaccine and some people do not. That's why it's a difference in numbers there. But they didn't see any type of poor effects in pregnant patients in the group that received the vaccine. So if they saw any type of poor effects or poor outcomes, it was in those individuals that did not receive the vaccine. So that meant that the vaccine didn't have anything to do with any type of bad events in the Moderna study. They are still continuing the study, so they're still following those people. So they also tested the Moderna vaccine in pregnant rats, and in those pregnant rats, they did not see any type of poor pregnancy events, meaning they didn't see anything happen due to those rats receiving the vaccine. So what does that mean to us? Rats share a similar makeup, a similar body composition, a similar biology, composition as humans. So we kind of use rats as something to predict what would happen in humans loosely. So with that being said, that kind of gives us that motivation to say, hey, if these rats did well after receiving the vaccine, then humans would likely do well as well. Also, this is an mRNA vaccine, and remember what I said about mRNA vaccines? They are disposed of, meaning they leave your body, so they don't in any way move into the placenta or invade the space where the baby is and affect the baby. So it is our idea that these vaccines would not affect pregnant women. So, what are the recommendations for receiving these vaccines? Who should get them and who should not? So, those individuals that absolutely should not get this are individuals that are allergic to polysorbate, or if you are related to allergic to any type of PEG, um, any polysorbate, any PEG, and if you are, these are included in foods, these are included in drinks, so these are included in other medications. So I am about 70 to 80% sure that if you were allergic to these, and you would know if you do receive a vaccine and you have an allergic reaction, it is not recommended that you get the second vaccine. And so, with that being said, if you know that you're allergic to these things, or if you've had any type of allergic reaction, make sure to talk to your physician, your primary care provider. So, whether that be a physician or a nurse practitioner, physician assistant, that you talk to them and you talk to them about whatever allergies it is that you may have in regards to any type of vaccines if you've had an allergic reaction to one. So, anyone that's had a prior COVID-19 infection, so it's not recommended that you get the vaccine until after your 10-day quarantine period. So, previously, I know it was recommended that you wait 90 days. And why was this? It was because it was predicted, or we thought that if you waited, that you would at least have protection for 90 days if you had previously had COVID-19. However, if a vaccine is offered to you and you have recovered from COVID-19 and it's been 10 days since your quarantine period, then we do recommend that you go ahead and get vaccinated. So to sum this up, whether you've had COVID-19 or not, you should still get vaccinated. If a vaccine is offered to you and it is past your 10-day quarantine period, then get vaccinated. The reason that we recommended the 90 days is because we didn't know if we would have enough vaccines to go around. But if a vaccine is offered to you, please get it. So those individuals that are pregnant, we talked about that in regards to vaccinating. Those individuals that are immunocompromised, it is recommended right now that those individuals do receive the vaccine. However, I would recommend talking to your primary care provider, once again, whether that is a physician, nurse practitioner, physician's assistant, that you talk to them prior to receiving this vaccine. And why is it that you want to talk to them? You just want to make sure that it doesn't interfere with any type of therapy that it is that you are getting. However, it is recommended that you do get the vaccine per the guidelines. Just make sure that you discuss it prior to. And just something else to add, there were about 2.8% of participants that did have stable HIV, that meaning that their HIV was controlled. And we know that those individuals that have HIV don't have the best immune systems. So they all performed well after they received the vaccine. They didn't see any type of poor effects on those individuals that had HIV. So with that, it is recommended at this time that if you are immunocompromised, that you still receive that vaccine. The same with autoimmune disorders, but you want to make sure that you talk to your healthcare provider first. If you have any questions, make sure to send them to your pastors, and then they'll make sure that they get back to me. It is my hope that this presentation assisted you all with answering any other questions that you may have had in regard to the vaccine. Thank you.